Ready? Okay, so for this clip, I will be using the person-centered approach, and I'll be working on the skills of unconditional positive regard, showing empathy, and having a calm presence with the client. The reason I chose the person-centered modality is that I wanted to build trust with the client and to feel that she would be working with me in a safe and supportive environment. From reading the scenario, it sounded like she was experiencing invalidation and misunderstanding from her family. And I'll just go ahead and read the scenario to you so you can kind of know where we're going from. Celine is a 20-year-old woman with a previous autism diagnosis, a previous PTSD diagnosis, and a suicidal ideation. Although she was the top of her high school class, she had to put her college dream on hold because she became too overwhelmed in her first semester of college. Her parents sent her to an inpatient facility to fix her. In her biopsychosocial analysis completed by the caseworker on intake, you see notes saying she is quiet and withdrawn. Other patients have also reported that she tosses and turns in her sleep and screams bloody murder in the middle of the night. At the beginning of your first session with Celine, she falls down on the couch with tears in her eyes, begging you to fix her. So, hi, Celine. It's nice to meet you.
Hi.
So my name is Holly Mickelson, and I look forward to working with you. Can you kind of tell me about what brought you in today for our visit?
Hmm. I've just been having a really hard time lately.
Okay, can you tell me about what's been going on?
Well, the reason I'm here is because I just dropped out of college and it's been super overwhelming for me, and my parents are really upset that I had to drop out of college, and so they just kind of sent me here because they don't know what to do with me.
Hmm, I see. And how has that been? How do you feel about that?
It makes me really sad because, I know I'm super smart and I've been working so hard, but I have autism, and it's a neurological thing, and it sometimes I just get really overwhelmed and it makes things really difficult.
Well, I do think you're smart and that you are a hard worker, and you've shown that from all of the hard things that you've done in your life so far. And I don't think you need to be fixed, Celine. You deserve to feel safe and understood. And I think we can just take it one step at a time and work together if you're okay with that.
Thank you.
Okay. So it sounds like from what you're telling me, everything has felt like too much for too long. You've had a lot of pressure and you feel like you've let your parents down and you've disappointed them. Is that correct? Am I understanding you correctly?
Yeah, that's correct. I just get overwhelmed really easily, and it's just difficult.
Okay. And it sounds like you're exhausted from this long time of trying for so hard and working hard on things. So,
Mhm.
when did things really start feeling painful for you? Can you tell me a little more about that?
Yeah, I guess for me, I I worked so hard to get into college, and I was at the top of my class in high school, and now I'm like moved away, and I have this dream. I'm studying philosophy, and I want to be a philosophy professor, but I take on too much at once sometimes, and I get really overwhelmed, and I just find myself hidden in my closet in the dark, like no sensory input, and I just sit there for hours just crying, trying to calm down and not be so overwhelmed.
Well, that sounds really hard. And what a beautiful dream, though. I think it would be amazing to be a philosophy professor. So, what do you feel like has worked so far to help you feel safe and calm when you're in this place and you start getting really overwhelmed?
I mean, the only thing that has worked, I mean, I guess I don't know if I would call it working, but like just whenever I get overwhelmed by like an assignment or like just how many things I need to get done, I just go into my closet and I just am in there and I'm at 100 and I'm just, in a loop for hours and it's hard to get out of it and I just feel like frozen. And then eventually I do come out of it. So that's the only thing that has worked and it's been frustrating.
Right. That sounds really frustrating, especially with trying so hard and it lasting so long. And it sounds like you just freeze there. Is that what I'm understanding?
Yeah, exactly.
Okay, good. So, what do you wish people understood about you?
I wish that people understood that like I am a really hard worker, but because like I have autism and like I just need more time for things and I need like space and I just that adding more pressure isn't going to make me complete my assignment. It's just going to make me feel more awful.
Yeah, that sounds hard. That sounds really hard when you feel pressured and that it's going to shut you down. So, you've made it through a lot and you've worked really hard and you've made graduating at the top of your high school class is a huge accomplishment. You should be feel very proud of that. And you're still here. You're still trying. So that's worth a lot. So you don't really have to prove anything anymore. This is your space, and we can kind of just work at whatever pace feels comfortable for you. So
Yeah.
we're just gonna kind of end that today for this clip. So I'm just going to pause and do the summary. So the reason we were using this person-centered modality with Celine was kind of to assist her by meeting her with compassion and understanding to set up the relationship. With her parents telling her that she needed to be fixed, it's essential to kind of create a space where she can begin to open up and start being able to trust. And I think trust is really foundational for any therapeutic process. So when Celine comes into therapy, it really appeared that she was feeling overwhelmed and broken, and allowing Celine to be the expert in her life and validating her strengths were hopefully going to help her build her self-worth. So we're going to go on to clip 2. So in this clip, um, I'm going to be using DBT with Celine. And I chose this modality to help her with her struggles regulating her emotions and to kind of help her build stress tolerance based on her suicidal ideations and to continue to help build that self-worth. I chose this because any deeper trauma work or insight building might, before that can be done, she really kind of needs tools to survive the intense emotions that she's experiencing. In our textbook, I felt like I learned that DBT is a good fit for clients who are manifesting emotional dysregulation, where they have strained interpersonal relationships and low self-esteem. That can be found on page 143 for reference. So we'll go ahead and jump into the second session with Celine. So hi, Celine. It's nice to see you again. How have you been
Hi.
doing since our last meeting?
Um, I've been doing all right. I'm still, you know, getting overwhelmed a lot. So,
Okay. Have you had any more suicidal ideations?
yeah, I have, um, sometimes when I'm feeling really overwhelmed and I go in my closet, I just think about how things might be easier if I, wasn't here anymore. And it's not something like I do want to be here, but at the same time, I definitely think about it.
Just when things are getting really overwhelming?
Hmm.
Can you kind of tell me what's triggering those thoughts when you're having those really big experiences with your emotional dysregulation?
Yeah, I think, when I look at I guess maybe like two things, like looking at my to-do list and just looking at how big it is super overwhelming. And then also just like anytime I get a text message from like my mom or my dad, like asking me if I've done any of my like assignments that are due, and they're just kind of like bashing on me like you need to work harder or why haven't you done this yet? It just kind of makes me feel really worthless.
That is intense. So thank you for sharing that with me, Celine. You're safe here, and you don't have to talk about anything yet. But let's just kind of help your body calm down so that you can kind of learn some skills in that. Okay, would that be all right with you?
Yeah,
So we're going to try something called TIP. Have you ever heard of TIP before?
I haven't.
Okay. So tip is a tool that you can use that's actually fast acting. And you talked about how hard it is when you have to stay in your closet for an hour. So we want to kind of give you some skills that are going to work a lot quicker for you. Okay. And these tools will help bring down those really big emotions and that get so overwhelming and might cause you to start having suicidal thoughts or just being so overwhelmed that you can't function. We're going to try it together if that's okay. And we'll just do one step at a time. Okay.
Okay.
So T stands for temperature. And
Temperature.
it's nice that this is like an acronym so that you can kind of remember it. And at the end, I'll have you write it down if you find this useful, and then that way you can use it in the future. So cold is actually a really good thing that can help reset your body from a panic response. So I'm going to give you this cold pack, and I want you to hold it for just a minute. You can hold it on your hands, you can hold it on your face, and sometimes when you're doing this and you want to do the cold, you can also find cold water if that works better. Go ahead and
Okay.
just put it on your face if that feels comfortable, and just breathe in really calmly in and out. And this is kind of telling your brain that you're safe, you're not in danger anymore. And let's just do this for a minute. So we're going to speed this forward and imagine that we did this for a little bit. Now, Celine, the I is for intense exercise. So if you're up for it, there's a couple different options. We could do like 10 jumping jacks if you wanted to try that, or we could do wall push-ups. What do you think you would prefer?
Let's do wall push-ups.
Okay. We're going to imagine that her and I did this together and did our 10 wall push-ups. So did you notice anything different after that?
Yeah, I think I was I wasn't thinking about like, my to-do list anymore. I was trying to figure out how to do a good wall push-up. So
Oh,
I guess
great.
it did take my mind off it.
Good. Now there's the first P in tip, there's two P's, is going to be for paced breathing. And there's a lot of different breathing exercises that you can do. We'll just try this one today and see how this works for you. And I want you to match your breathing with me, and I'm going to guide you through it, okay? So I'm going to breathe in for 4, and then I'm going to hold it for 4, and then we're going to breathe out for 6, nice and slow. Are you ready to try it?
Mhm.
Okay, so breathe in for 4, hold, breathe out for 6. Now, Selena and I would do this for probably 3 or 4 more rounds. For the essence of time, we're going to move on. The next piece, Lean, is called paired muscle relaxation. And this one's really good when your body feels really tense or shaky, or you feel like you want to curl into yourself. Maybe it's a time when you want to go into your closet. And maybe try this in your bed, just laying down, or you can actually do it anywhere. But what you're going to do is you're going to use your muscles and your breath together to help your brain feel safer. So would you like to try it with me for just a couple minutes?
Mhm.
So then I would walk Celine through this where she would tense muscles, relax them, different muscles, and practice breathing in and out. For time's sake, we'll just move on. Nice job, Celine. You helped your nervous system kind of settle down, and that's a really powerful thing to know how to do, especially when you start having those really big emotions. Can I have you write this down, and we'll just list it just like we did today, so if you found this helpful, you can use it in the future. Does that sound like a good idea? Do you have something to
Yeah.
write with, like a sticky note or something, or put it on your phone? What do you think would be best
Yeah.
for you?
I'll use my phone.
Okay. So imagine that we walked through this and I helped her remember the acronyms and put this on her phone. Okay, we're going to try one more thing that'll be just another tool for you, Celine, that maybe you can use if things are starting to get really overwhelming, and this might work. So let's try a short mindfulness skill together. And this one's just about noticing. There's no fixing, no judging, no changing. All we're going to do is just be about being right here in the moment with curiosity instead of pressure. Does that sound good?
Hmm.
So I'll walk you through it just like I did the other ones. So let's go ahead and take a slow breath in through your nose and then breathe gently out through your mouth. Now I just want you to look around you, and what do you see there in your room? You might be seeing colors, shapes, different lights or shadows. And just go ahead and keep observing that. You don't need to name anything right now. You're just kind of looking. Give her about a minute to do that. Now I want you to notice what you hear. So the sounds you hear, are they far away? Listen to what's close to you, or maybe even silence. And we would do this for another minute. Now I want you to shift your attention inside your body. How do you feel in your body right now?
I feel I feel a little calmer.
Okay, great. So I want you to pay attention to, like, are your shoulders tight? Is your jaw clenched? How are your feet feeling? Are they feeling kind of warm or cold?
I do feel like my jaw has some tension.
Okay. So you don't need to judge that. You're just going to be noticing how your body feels. And now I want you to describe one thing you notice. And you might say in your mind, you don't have to even say this out loud to me, I hear a humming sound, or my hands do feel cold. Go ahead and do that in your mind. Okay, so that's it. You just practice some mindfulness. So if you do this a couple times a day, even just for 1 minute, it can help your brain feel more grounded. And so when those big emotions start taking over, it's kind of like a mental anchor. It's going to help you to be able to stay in control. And the more you practice these, it's just a really good tool so that it keeps your emotions from getting too big. Do you feel like that's
Okay.
something that's going to be beneficial for you to try in the future?
Yeah, I think that like any of these will probably be, I don't know if it'll like get me all the way down, but it will be better than just staying in my closet.
That will be great. I think so too. So at this time, I would help her remember some things for the mindfulness activity, add them to her phone so that she would be able to have those tools available to her. So, Celine, before we wrap up today, can we take a moment to kind of check in on you and see how your session went for you? Is that all right?
Yeah.
What do you
I
think? Oh, go ahead, Celine.
oh, I was gonna say I think like I appreciate, being able to learn a few things that might be helpful for me when I'm get feeling overwhelmed. So that was really nice.
So, was there anything that was kind of confusing or uncomfortable for you?
I definitely felt like some of the tip skills, they were a little uncomfortable for me. I know that's kind of the point, but some of them I'll use, some of them I probably won't use.
Okay. Could you just maybe try them out, maybe when you're not in a setting with a therapist, and see if they are a little more comfortable for you when you're having big emotions? Is that something you could commit to?
Yeah, I think that's something I could do.
Did you notice anything shift in your body today when we were doing any of these, or any of your emotions kind of calm down?
I think I overall felt calmer. So even like if I'm in a really heightened emotional state, like I said, it might not like be all the way calm, but just having it get me to a calmer state faster will be very helpful.
Well, and I hope some of these are things that you can use anywhere, because if your coping skill right now is to be in your closet, that's not always accessible, right? So we've got to
Mhm.
help you be able to have some coping skills that you're able to practice in other places if those big emotions start coming. So, is there a way that you could remind yourself about these, like maybe using a sticky note by your bed and put your favorite tip practice on there?
Yeah, I think I could set up like a notification reminder on my phone.
Oh, that's a great idea. Perfect, perfect. So the next time we meet, can we kind of talk about what worked for you with trying these out on your own and tweak it a little bit to better fit you?
Yeah, I mean, not that I'm planning to be in my closet, but I know it will happen. So I think I will definitely have opportunity to use this.
Great. Well, this is just a toolkit. We're going to keep building it for you to keep having more tools in your toolkit to be able to help you when those big emotions come, okay?
All right. Thanks.
It's good to see you today. So end of the session there, let's have a little summary recap. So using the DBT modality with Celine will help her kind of advance in her treatment goals by giving her those concrete tools to regulate her overwhelming emotions. And by using the TIP tool and mindfulness, this will hopefully give her tools that will help her deal with like feeling hopeless or her urge to do self-harm. DBT can help her gain control over her internal experiences from what we've learned and transition from merely surviving to developing the skills she needs to empower herself. All right. Thank you.